imagine, or maybe you actually don't have to imagine, this sharp pain that comes out of the blue. What is going on? Was it something that you ate? Did you pull a muscle? It hurts really, really bad. You're thinking, is it my appendix? But no, my appendix has been removed. But no, it's diverticulitis. So in today's video, we're gonna tell you everything you need to know about diverticulitis. We'll discuss what exactly is diverticulitis, what are risk factors for getting this, how do we diagnose it, what do we use as doctors to treat it, and at the very end of the video, I want to give you 5 tips I recommend as your poop guru to make sure you don't get diverticulitis. Guys, if you're wondering about this disease, this video is for you. Let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe so you get more videos like you're watching in today's video. So before we begin, I want to tell you a story, a real story about a patient of mine. Her name was Nancy. Now Nancy was a very active woman. She did everything: CrossFit, marathons, triathlons. She was so active it would take anything to bring her down or slow her down. Now one day in the middle of a marathon, she had this really bad abdominal pain. It was crippling for her. She thought she may be dehydrated or she pulled a muscle, but that pain did not get better to the point where she had to go to the emergency room. And that's when we saw her and we ordered a CAT scan, and she ended up having what's called diverticulitis. Now after a couple of days of antibiotics, she felt better, went home, came to see me in the follow-up, and we discussed what options we can do to make sure it does not come back. Does this story sound familiar to you? Because there are millions of people out there that have diverticulitis. So what the heck is it? So in your colon, you have these pockets called diverticulosis. These are outpouchings in your colon that occur because of age or constipation. This is perfectly normal. About 40% of the US population have these outpouchings that are there. Not a big deal. But on the occasional basis, something could get stuck in those outpouchings. The most common thing being poop. Yes, feces can get stuck in that pocket, and over time, that can cause irritation, inflammation, and causing what's called diverticulitis. So in reality, diverticulitis is inflammation of the osis. That's exactly what itis means, inflammation. Now when this becomes inflamed, you feel that pain. It's usually in your left lower quadrant called the sigmoid colon. You have pain, you may have bleeding, you may have fevers and chills, you just don't feel very, very good. So what exactly are the risk factors for diverticulitis? There are a couple you should be aware of. Number 1 is smoking. Guys, smoking sucks. It's terrible for everything, including your colon. In fact, smoking can substantially increase your risk for developing diverticulitis. Number 2 is obesity. The fatter you are, the more pockets you have, and the more chances of those pockets becoming infected and inflamed. Number 3, aging. I know, aging sucks. But as we get older, the chance of having these pockets go up, and the chance of those pockets getting infected goes up as well. And it's just a consequence of age. Unfortunately, things don't get better sometimes as we get older. Your diet can also play a role. In fact, having a diet that's low in fiber will make it more likely for you to have an infected pocket in your colon. Then lastly, certain medications can increase your risk for diverticulitis, mainly non-steroidal anti-inflammatory medications or NSAIDs. Medications like Aleve, naproxen, Advil, Motrin. This causes inflammation inside your colon to increase your risk for developing diverticulitis. So how do we diagnose diverticulitis? Well, one of the more common mistakes that people and physicians make is that they think this is a clinical diagnosis. No way! You cannot diagnose this clinically. I can't just tell you, hey, I think you got diverticulitis because you have pain. No way, no how. You must have a CAT scan. Yes, a CAT scan or a CT scan is the best way for us to diagnose diverticulitis, and this is the only way for us to accurately know what's going on. Because pain on your left side can be due to a lot of different things, and I don't want to give you unnecessary treatment until I know exactly what's going on. So what exactly is that treatment? Well, because it's inflammation of your pockets, we have to give you medications to decrease that inflammation, namely antibiotics. We give patients antibiotics, either oral antibiotics or IV antibiotics, to help decrease that inflammation and to make sure those inflammatory pockets don't get worse. We do know that antibiotics will decrease the risk of you developing complications from that diverticulitis, mainly causing an emergent tear inside your colon. So are you wondering what you can do today to prevent your risk for developing diverticulitis? Or have you had diverticulitis and you want to make sure you don't have it back? Here are 5 tips I recommend. Number 1, eat your fiber. You know, watching my videos, that fiber is the foundation for gut health. And the more fiber that you have in your diet, the more healthy it's going to be for your colon, your gut microbiome, and to decrease your risk for developing diverticulitis. So have more plants, have more vegetables, have more fruits. Your colon will thank you. Number 2, drink more water. The more water that you drink, the easier it's going to be for things to pass through, and the more likely it's going to be for your colon to be happy and healthy. Number 3, put down those cigarettes. Don't smoke. Smoking's terrible for you, and it for sure will increase your risk for developing inflammation of the colon. Number 4, minimize meats. We know that a diet that's heavy in meats increases your risk for developing diverticulitis. Avoid red meat, smoked meat, pork. These are the big ones that can really inflame your colon and make it harder for you to beat this condition. And then lastly, get moving. Yes, exercise will help move things along, pass things through, decrease inflammation, and improve your gut microbiome. One last tip I want to give you, you may have seen on the internet, to avoid things like nuts, seeds, popcorn, things like that. Here's what the GI doctor says. Who cares? There's no evidence at all that these foods, seeds, nuts, popcorns, things like that, increase your risk for developing diverticulitis. It is a common myth, a common wives' tale, and there's no evidence for that whatsoever. So if you want to enjoy that, go crazy. I don't care, because it doesn't make a difference when it comes to your diverticulitis. Here's my call to action for you. Hopefully you've never had diverticulitis, but if you have, or you know somebody who has, try to implement my tips to decrease your risk for developing inflammation of your colon. And if you're worried, start with changes that become easy. Drink more water, go for a little exercise. Do these simple things to get you on the steps to make sure you don't have a recurrent problem. My question today for you, have you had diverticulitis? What have you tried? What worked? What hasn't worked? Comment down below. I would love to hear what you guys have to say. Well, thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe so you get more videos like you're watching on today's channel. Well, thank you for watching. Don't forget, let's talk about poop. Thanks, everybody.